Welcome to Module 4, where we will be discussing Medicaid very briefly. What is Medicaid? Medicaid is a federal and state government partnership that is run by each state, so eligibility varies from state to state. Medicaid covers low-income individuals or individuals living with certain disabilities. You apply for Medicaid through Iowa HHS, and this does not travel from state to state. For example, if you live in Iowa and receive Medicaid, but you move to Nebraska, your Medicaid does not travel with you. You would have to apply for Medicaid in the state of Nebraska. In Iowa, we have expanded Medicaid, meaning that those are eligible for Medicaid if their income is under 138% of the federal poverty level, and they're eligible based on other factors like immigration and resource limits. We have included a Medicaid cheat sheet on our income guidelines worksheet that's located in the REMI resource library. We update this every year in January, and it should help you determine if a client is eligible for Medicaid or should apply for Medicaid based on their income. There are some other factors that go into whether or not a client should apply for Medicaid, but the first step is looking at someone's income. Additionally, this chart could tell you if a client is receiving Medicaid, but you aren't sure what type of Medicaid they're receiving. You could look at the factors such as their age, what their poverty level is, what their income source is, and if they're also enrolled in Medicare. So who is eligible for Medicaid in Iowa? Children who are under the age of 21, a parent who's living with a child under the age of 18, a woman who is pregnant, a woman who is in need of treatment for breast or cervical cancer, a person who is elderly, age 65 and older, a person who is disabled according to Social Security standards, any adult between the ages of 19 and 64 whose income is at or below 138% of the federal poverty level, and a person who is a resident of Iowa and a U.S. citizen. Others could qualify, so this is where we would ask you to staff these questions with the BDAP team or with your agency's field benefit specialist. They will have specialized knowledge on who may or may not qualify for Medicaid. There are different types of Medicaid in Iowa. The biggest and largest program is the Iowa Health and Wellness Plan. That is known as expanded Medicaid in Iowa. So that's going to cover the folks that are between the ages of 19 and 64 whose income is at or below 138% of the federal poverty level. We also have other types of Medicaid. Some that you might come into contact with would be Medicaid for employed persons with disabilities. This is the MEPD program. Some have called it MEPID. This is Medicaid for people that work but also receive disability benefits. There's dual eligible Medicare and Medicaid recipients. So folks who are enrolled in Medicare, but their income is so low that they cannot afford a lot of the Medicare cost sharing that we talked about in our last module. So Medicaid will often come in and act as a secondary insurance or a supplemental to reduce their cost sharing. That also goes into the Medicare savings programs, which would include qualified Medicare beneficiaries or QIMBY, or specified low-income Medicare beneficiaries or SLIMB. There's also a medically needy spend down program. That program works by saying someone would normally qualify for Medicaid, but they make too much money. However, if they were to spend all of their money on their outstanding medical debt or medical needs, then they would be eligible for Medicaid. So that's the needy spend down program. We also have presumptive eligibility. And so presumptive eligibility is available to some of your agencies. Healthcare clinics that says you meet with a client that day, you could determine that they're most likely going to be eligible for Medicaid, so you could get them a presumptive enrollment into Medicaid that'll act as a temporary coverage until they transition to full Medicaid. but there's more to say about presumptive Medicaid in a couple of slides from now. Less common, we see the Hawkeye, which is Iowa's Children Health Insurance Program, so that's available for kiddos. We also have home and community-based services waivers and the health insurance premium payment program, which we do not see a whole heck of a lot of here. So in order to be eligible for Iowa Health and Wellness, you have to be an Iowa resident and meet income requirements. This is managed through Iowa HealthLink. So Iowa HealthLink, you receive care through a managed care organization known as an MCO. And an MCO is a contract between Medicaid and an organization that's based on fees. And so currently in Iowa, I believe we have 3 managed care organizations that a client would be assigned to, one of 3 that they would be assigned to when they're approved for Medicaid. For the first year of someone's enrollment on Medicaid, they have comprehensive health coverage. There's no cost to them for the first year. However, each year after the first year, they must take the following steps in order for their Medicaid to remain free for them. So they have to complete a health risk assessment and I should say, get a wellness or dental exam. And I believe the wellness and dental exam requirements are pretty loose in that you need to see a provider or have seen a dentist in the last year. For the MEPD program, Medicaid for Employed Persons with Disability, in order to be eligible for this program, you must be deemed disabled by Social Security. You must have earned income through employment or self-employment. You must have income that does not exceed 250% of the federal poverty level and not exceed the resource requirements. You will have a monthly premium if your income is above 150% of the federal poverty level, but you are entitled to all Medicaid benefits and it will pay for all of your Medicare premiums, and you will incur very small copays on things like doctor visits and prescriptions. Those copays are generally between $1 and $3. What we are seeing more and more of as our population is aging is dual eligibility. So for those who qualify for Medicare and Medicaid, they receive coverage from both. Medicare will always act as the primary payer. It will pay first for what it covers, and then Medicaid coverage acts as a secondary payer. So it will pay for anything covered by the plan that the primary payer doesn't cover as long as Medicaid can cover it. So there are some things that Medicaid does not cover. If someone has full benefits, that means they have Medicare and full Medicaid coverage. If someone has partial benefits, it means they have Medicare and they likely have a Medicare savings program like the QIMBY or the SlimB that we mentioned earlier. We don't expect that as a case manager you would have very robust knowledge of Medicare and Medicaid dual eligibility. We just want you to have like a very basic understanding that someone could have Medicare and Medicaid, and that Medicare always acts as the primary and Medicaid acts as the secondary. But we want you to be sure to connect with your FBS or to reach out to us in the BDAP to discuss dual eligibility. I will say, as we're processing applications, we often will try to screen somebody on our end to see if they might be eligible for one of these programs. In the same vein, there's the Medicare Savings Program that I mentioned in the last slide. So to be a qualified Medicare beneficiary or QIMBY, this would be someone who's eligible for Medicare Part A. They have income below 100% of the federal poverty level and meet the resources below the resource guideline. And if you have QIMBY, what this does is it pays your Part A premium, it pays your Part B premium, and deductibles, coinsurance, and deductibles of A and B covered services. This person would also qualify for that Part D low income subsidy, also known as extra help. On the same hand, if you are someone who qualifies for SlimB or specified low income Medicare beneficiary, you're eligible for Part A. You've got income between 100 and 120% of the FPL. You meet the resource limit, and you do not qualify for any other type of Medicaid. For Slim B, you have your Part B premiums paid only, and you will also qualify for Part D low income subsidy or extra help. So like I mentioned previously, if you are medically needy or have a spend down, this is if a client would not normally qualify for Medicaid due to income or resources, but medical bills are requiring most of their income in order to be paid. So they may be eligible for this program. The medical bill amounts are subtracted from their income and resources, and if they meet the spend down amount, Medicaid benefits can be activated. The eligibility varies from different groups, like pregnant people or those who are living with disabilities or folks under the age of 21. I would say that we most commonly see this with folks that are entering into nursing homes. Sometimes it looks like they have too much income or too much resources, but the level of skilled care that they need would take most of their income, and so they would be Medicaid eligible at that point. Again, presumptive eligibility, or PE, that I mentioned before, it's a temporary Medicaid coverage while a full Medicaid determination is made. So Medicaid will ask for additional information after your client receives their temporary approval. So clients really do need to be paying attention to mail that is coming to them when Medicaid's asking for additional documentation. So a client has their reported information entered by a qualified entity that's been designated by HHS. For a lot of you, it's going to be if you're in a clinic setting. However, you can only apply to presumptive eligibility once per calendar year, and this application is not available at all agencies. Like I mentioned, you have to be a qualified entity. So please work with your FBS to determine if presumptive eligibility is available to you. It's a great tool, especially for those providers that would like to be paid the day that they're seen, or those that are utilizing sliding scale or Part C funds. For a Medicaid application logistics, once a client has applied for Medicaid, this is like full Medicaid, not the presumptive eligibility, Iowa HHS has 45 days to make a determination. And while waiting for that determination, a client may receive medication assistance from the BDAP. So once they're approved for Medicaid, the client should be discharged from BDAP, as Medicaid should cover all of their costs. If a client is in process because they're waiting for a Medicaid determination, you must remove the client from in process with an insurance update when you're discharging them from the BDAP. And if your client is denied Medicaid, you should be working with your FBS to obtain alternative coverage for your client.